What it comes down to with these Parkinson's patients, and really all of the patients that we see here, is to improve the quality of their life. For Parkinson's patients, there's a whole continuum of severity, and the sooner we get to see them, the better it is. A lot of times, particularly in the later stages of Parkinson's, the volume of the speech goes way down. So we work on that and help them be able to express themselves and feel more comfortable. One of the big things that we really focus on is balance and stability. A high percentage of people with Parkinson's, particularly in the later stages, will fall down several times per week. When you have Parkinson's and these other things layered on top of it, a fractured wrist, a broken hip, things get a whole lot harder. So prevention is a really big part. I think that our treatment style here is based upon a good understanding of what the patient's needs are. Usually treatments involve multifaceted interventions. Exercise, of course, of many different varieties. Manual therapy of many different varieties. Dry needling, modality care, things like ultrasound and electrical stimulation and heat and cold are some basic things. When we have an initial evaluation, we sit down with somebody, and on that first day, the history taking is the most important part of that evaluation. With balance and instability, one part of the history taking is how does that affect them? Are they falling down? If they are, how often? Do they lose their balance? Have they had any injuries associated with those falls? Those all play an important role in deciding what kind of program we're going to design for them. Parkinson's exercises, we divide them into different categories. There's a lack of motion, so there are range of motion exercises and stretching exercises. There is strength component, because controlling movement and having strength to do functional tasks is important. Posture, body mechanics, balance, endurance, vocal volume, facial expression, all of those things go into what we want to provide for somebody. And that has all kinds of cascading effects that helps them in their day-to-day life and interacting with other people. A couple of the different classes of balance exercises that we do are static balance and dynamic balance. The static balance would mean that you're standing still, you maintain your stability, you can do it with eyes open or eyes closed. And then there's dynamic stability or dynamic balance, which is what you have to have when you're moving about. There are other exercises that we do, like boxing exercises, which the patients love. They move left and right. They're not thinking about their balance. They're not thinking about really what they're doing. That's usually a highlight of some of the people's exercise programs. Most people with Parkinson's will be coming in 2 times a week, or we be working with later on with a personal trainer, seeing us every couple of weeks or even once a month. There's a better quality of life when there's better strength and balance and mobility. And so a lifelong pursuit of that, whether you're getting a late start on it when things are starting to become difficult, or you're catching it early on, is a good thing. Our patients have to see, when we talk about outlining their program for it, how it's going to affect their life. It's not just about, am I going to do X, Y, and Z exercise? It's how it's going to impact them, whether it's going to see their grandchildren, whether it's going to see their sister down the street, whether it's picking up their cat. Those kinds of things really give people joy, and when they're able to do it, they feel good about it, and they have some control over it too. And they're not alone. There are a lot of people, other people out there who are going through the same thing. We understand that, and we work to try to get them back to the things that they really enjoy.